So the BOVen study is a pilot study. We're trying to determine the ability to achieve undetectable minimal residual disease in a cohort of patients. This was a relatively unfavorable group. 72% of patients had unmutated IGHV. 15% of patients had a aberrancy of TP53. Certainly, the lead-in with zanabrutinib and Obinutuzumab did exactly what we wanted to do. Just under 50% of patients entered the trial with high-risk disease for tumor lysis. 49% of patients had intermediate risk disease for tumor lysis. By the time we ramped up venetoclax, 70% of patients had low risk for tumor lysis, and only 9% of patients were still high risk. So we made it safer. Of the 39 patients, only 2 patients actually needed to be initiate their ramp up for venetoclax in the hospital. It was a surprisingly well-tolerated treatment. We expected, based on the results of other triplet combinations with ibrutinib or acalabrutinib, to see a lot of neutropenia, though about 50% of the patients developed neutropenia. Grade 3-4 neutropenia was seen in only 15% of patients, much lower than what we expected. But the most exciting thing is that the ability to achieve undetectable minimal residual disease, the minimum time, the median time to develop undetectable minimal residual disease was 6 months. That's the earliest we actually looked for it. In fact, 62% of patients have met the undetectable minimal residual disease endpoint and have stopped treatment at a median of 8 months. Thus far, with some further follow-up, we know that 84% of patients are MRD undetectable in the blood and 73% in the marrow. So we expect over time to see an increasing number of patients discontinue treatment. But the data that we presented was at a median of 11 months.